Hi viewers, heartfelt welcome to this video. This section covers KUHS question paper of Management of Nursing Services and Education asked in April 2019. It is part C of answer key. The aim is to equip each student with a basic idea about the technique of presenting the answer during the exam. This slide will tell you the essays asked for the examination. There were 2 essays. Each essay carried 15 marks. Question number 1. Define supervision. Enumerate the types of supervision. Explain the principles of supervision. Number 2. Define budgeting. List down the purposes of budget. Describe the role of nurse administrator in budgeting. Always read the instruction before answering the questions. Answer all questions and draw diagram wherever necessary. It is better to draw diagram in each answer, at least one. The answer key of these 2 essays we have seen in the previous video as part A. The second category is short notes. Principles of adult learning, students welfare programs, methods of staff recruitment, principles of administration and teaching system. The answer keys we have seen as part B. The third category, enumerate the following. The questions were 4 functions of leadership, 4 uses of job description, 4 principles of collective bargaining, 4 advantages of nursing audit, and 4 factors influencing staffing. The fourth category was differentiate between. The questions were administration and management, strategic planning and operational planning, records and reports, centralization and decentralization, capital budget and revenue budgeting. In this video, part C, we will see the answer key of enumerate the following and differentiate between. Let us begin with the answer key of enumerate the following. There were 5 questions, each carried 2 marks. 4 functions of leadership. Under enumerate the following. You can see here 8 functions are mentioned. Out of this you need to mention any 4. The first function, providing an example. Second, defining the task. Third, planning. Fourth, briefing. 5, controlling. 6, evaluating. 7, motivating and organizing. 8th one. These are the 8 functions of leadership. Out of this 4 you have to mention in your answer sheet. The 9th question, 4 uses of job description. You can see here 10 uses are mentioned here. You need to mention at least 4. The first use, job grading and classification. Second, placement of new employees on a job. Third, orientation of new employees about responsibilities. Fourth, promotion and transfers. 5, adjustment of grievances. 6, investigating accidents. 7, work measurement and work improvement. 9, health and fatigue studies. 9, time and motion studies. And 10, employee counseling and vocational guidance. Out of this 10, you can mention any 4. Next question under enumerate the following was 4 principles of collective bargaining. 5 principles are mentioned here. Out of this, you have to mention any 4. Collective bargaining should be made on education as well as bargaining process. Second, the management and trade union must look upon collective bargaining as a means of handling the best possible solution. Third, both parties to a dispute should command the respects of each other and should have enough bargaining power. Fourth, there must be mutual confidence and faith. 5. There should be an honest, able and responsible leadership because only this kind of leadership will make collective bargaining effective and meaningful. 4 advantages of nursing audit. 6 advantages are mentioned here. You need to write only 4. First one, it can be used as a method of measurement in all areas of nursing service. Second, the 7 functions are easily understood. Third, the scoring system is fairly simple. 4. The results are easily understood. 5. Assess the work of all those involved in recording care. 6. May be useful tool as a part to quality assurance program in all areas where accurate records of care are kept. The 12th question is 4 factors influencing staffing. 6 factors are mentioned here. You need to write only 4. First factor, the type and philosophy and objectives of the hospital and nursing service. Second factor influencing staffing, the population served or the kind of patients served. Third, the number of patients and severity of their illness. 4. Availability and characteristics of nursing staff. 5. Administrative policies, and 6. Standards of care desired. Next category is differentiate between. Number 1. Difference between administration and management. You can see it is written as a table. The first column, the basis of difference, second administration, third management. Under the basis of difference, level of organization, administration top level, management middle and lower level. Major focus, administration policy formulation and objective determination, policy execution for objective achievement. Nature of function, determinative and executive. Scope of function, administration broad and conceptual, here it is narrow and operational. Factors affecting decision, mostly external, here mostly internal. Employee-employer relation, here it is entrepreneurs and owners, here is employee. Qualities required, administration requires administrative qualities and management requires technical qualities. 7 differences are written here. It is better you mention at least 4. Question number 14. Strategic planning and operational planning. First difference, strategic planning. It decides major goals and policies of allocation of resources to achieve these goals. Operational planning decides the detailed use of resources for achieving these goals. Strategic planning is carried out under higher levels of management. It is carried out at lower levels of management. Strategic planning is long-term, operational planning is short-term. Strategic planning is based on long-term forecasting considering the possible impact of political, economical, technological and competitive factors. Operational planning is generally based on past performance of the organization and is less uncertain. Strategic planning is less detailed, operational planning is more detailed. It's good to mention at least 4. Coming to the differences between records and reports. The first difference you can see, report is oral or written and the record is always it is permanent communication. Report occurs between staff and other healthcare provider, also include lab reports. Here the report is always written and it is a part of legal document. The third difference, report can be prepared on the basis of records. Report can be presented as record. The fourth difference, especially oral report can be forgotten while the record is preserved for a long period of time. The difference between centralization and decentralization. You can see the points here, centralization and decentralization. Coming to the meaning of both terms, centralization, when all the power of decision making are concentrated in top management. Decentralization means when authority to take decision is delegated to all levels of management. Importance of subordinate. In centralization, reduced importance of subordinate. In decentralization, give importance to subordinate. The decision-making power in centralization lies in the top level. In decentralization, it lies in all levels of management. Delegation of authority. There is no delegation in centralization, but in decentralization there is delegation to all levels of management. The burden on superiors, in decentralization it is increased and in centralization it is increased and in decentralization it is reduced. The difference between capital budget and revenue budget. You can see here, on the basis of inclusion, the revenue budget consists of revenue receipt and revenue expenditure. The capital budget consists of capital receipt and capital expenditure. Meaning the types: revenue receipt, it includes government receipts. It neither creates liability for the government nor creates any reduction. Revenue expenditure, it is an expenditure that neither creates any asset nor causes any reduction of liability. Coming to the capital receipt, it is a government receipt that creates liabilities or reduce assets. Capital expenditure, it creates assets for the government or cause reduction in liabilities of the government. Examples of revenue receipt are income tax, gift tax, etc. Examples of revenue expenditure are old age pension, salary, scholarship, etc. The examples of capital receipt are loans by the government, recovery of loans, etc. Capital expenditure include shares, repayment of loans, etc. That is the end of this video. Please support this channel by subscribing and sharing. Thank you.